Hello everyone, my name is Sam. I'm a GP. Today I'm going to give a talk on a topic called upper abdominal pain. Upper abdominal pain is very common in general practice. So it is very important that any medical practitioner or medical student must familiarize themselves with a list of common causes of abdominal pain. To do that, we must have a system to do so. So before I move on, I need to quickly revise the general principles of history taking. Number one, we must know the general anatomy of the human body. Number two, we must be able to identify the primary organ at the location of the symptom. And number three, we must be able to identify the surrounding or related organs. Number four, we have to think about the pathological process that can affect the organ. Number five, we must be able to use the key features to identify the most likely causes of the presenting complaint. You can see here that for number 4, the mnemonic that I used to identify the different pathological processes is Intomat DDD. I will quickly go into this mnemonic on the next slide. So this is the mnemonic. I stand for infection or inflammation, N for neoplastic, T for traumatic, O for obstruction, M for medication and drug, E for endocrine, including thyroid and diabetes, and D for depression. The next 4 Ds are deficiency, degenerative, dysfunction, and developmental. So this is the anatomy of the upper abdomen. The upper abdomen, as you can see, has got the abdomen, the liver, and above it is the lung and the heart. So this is the liver again. And if we take out the liver, we can see that there is a kidney, which is behind the liver and the stomach. The esophagus actually lies above the stomach. And if we turn the liver and the stomach around, we see that the gallbladder is just underneath the liver, and the pancreas and the spleen is just behind the stomach. So we have to think about all these organs when we think about the differential diagnosis of upper abdominal pain. So here is a table that I used to look at the different causes of upper abdominal pain. The first thing that comes to mind is the stomach. So common causes of upper abdominal pain includes Helicobacter infection, gastritis, neoplastic process include gastric cancer, which usually happens in an older population group, gastric ulcer, which can happen in most adults if they are under a lot of stress, taking medication, or have Helicobacter infection. Obviously, NSAID is a common cause of medication-induced stomach pain. The esophagus also can cause stomach pain if it is being inflamed. This usually happens from acid reflux from the stomach into the esophagus, known as reflux esophagitis. Next, we have got a small intestine, which is below the stomach. Duodenal ulcer can also present as upper abdominal pain. The next organ we look at is a gallbladder. The gallbladder can present as generally a right upper quadrant pain associated with nausea. And the common causes are cholecystitis, which is inflammation of the gallbladder. Rarer causes include ascending cholangitis, which is inflammation of the bile duct itself. An obstructive process in the gallbladder includes the biliary colic, which happens when there is stone within the gallbladder. Next, we look at the pancreas. The pancreas is usually inflamed in a process called pancreatitis, which usually presented with upper abdominal pain radiating to the back. For kidney, infective process can also cause abdominal pain, but usually more so in the right and left flank area, depending on whether it's the left or right kidney that is being affected, and is usually associated with radiation of pain to the groin area. Renal colic also cause similar pain and also is associated with radiation of pain to the groin area. Having looked at the abdominal organ, we also have to think about the heart, which can present as epigastric pain. especially so in elderly population. And the vasculature are equally important. We have to think about the potential of a rupturing abdominal aortic aneurysm or dissecting aneurysm of the aorta. And finally, infective process in the lung includes pneumonia, and obstructive process includes PE if it happens in the lung. This is the message that I want the reader to take home as well. You only see what you actively look for. You only look for what you know. So you cannot see what you don't know. So it is very important that any medical practitioner or medical student should have in mind already the different organs that may be causing upper abdominal pain, so that he can go through the list of the different organs as well as the different process that can affect the different organs. And depending on the age group of the population that he is seeing, as well as the history from the patient, one will then be able to come up with the list of most likely cause of the abdominal pain. Again, know your general anatomy, identify the primary organ at the location of the symptom, identify the surrounding organs, think about the pathological process, which is intimate DDD, and then use the key features to identify the most likely cause of the presenting complaint. Thank you very much for watching this video. If you like my video, please kindly subscribe. And this is my disclaimer. Thank you.